Do you know about GOLD?
Gold jewelry?
Not exactly. GOLD stands for the Global Initiative for Chronic Obstructive Lung Disease. Representatives from many countries serve as a network for the dissemination and implementation of programs for diagnosis, management, and prevention of COPD. Let's look at my pocket guide. I made you a copy.
Thank you.
You're welcome. It was updated in 2015.
One of my family members, my father, has COPD. Do you think this gold thing would help him?
Chronic obstructive pulmonary disease, or COPD, is a major cause of morbidity and mortality throughout the world. Much has been learned about COPD since the Global Initiative for Chronic Obstructive Lung Disease issued its first report, Global Strategy for the Diagnosis, Management, and Prevention of COPD, in 2011. Treatment of COPD is now aimed at immediately relieving and reducing the impact of symptoms, as well as reducing the risk of future adverse health events such as exacerbations. These dual goals emphasize the need for clinicians to maintain a focus on both the short-term and long-term impact of COPD on their patients. A framework for COPD management that matches individualized assessment of the disease to these treatment objectives will better meet each patient's needs.
So what is this COPD?
Chronic obstructive pulmonary disease, a common preventable and treatable disease, is characterized by persistent airflow limitation that is usually progressive and associated with an enhanced chronic inflammatory response in the airways and the lungs to noxious particles or gas. Exacerbations and comorbidities contribute to the overall severity in individual patients. The definition does not use the terms chronic bronchitis and emphysema and excludes asthma, which is reversible airflow limitation. Symptoms of COPD include dyspnea, chronic cough, chronic sputum production. Episodes of acute worsening of these symptoms, which is called an exacerbation, often occur. Spirometry is required to make a clinical diagnosis of COPD. The presence of post-bronchodilator FEV1 to FEVC of less than 70% confirms the presence of persistent airflow limitation and thus of COPD.
So what causes this COPD stuff?
Worldwide, the most commonly encountered risk factor for COPD is tobacco smoking. Outdoor, occupational, and indoor air pollution, the latter resulting from the burning of biomass fuels, are other major COPD risk factors. Non-smokers may also develop COPD. The genetic risk factor that is best documented is a severe hereditary deficiency of alpha-1 antitrypsin. It provides a model for how other genetic risk factors are thought to contribute to COPD. COPD risk is related to the total burden of inhaled particles a person encounters over their lifetime. Tobacco smoke, including cigarette, pipe, cigar, and other types of tobacco smoking, popular in many countries, as well as environmental tobacco smoke, or ETS. Indoor air pollution from biomass fuel used for cooking and heating in poorly vented dwellings, a risk factor that particularly affects women in developing countries. Occupational dust, chemicals like vapors, irritants, and fumes, when the exposures are sufficiently intense or prolonged. Outdoor air pollution also contributes to the lungs' total burden of inhaled particles, although it appears to have a relatively small effect in causing COPD. In addition, any factor that affects lung growth during gestation and childhood, like low birth weight or respiratory infections, has the potential to increase an individual's risk of developing COPD.
So this Mrs. Tubbs you were talking about, did she smoke?
Remember how I told you that Mrs. Tubbs comes by a lot? She's been a patient several times. She's a heavy cigarette smoker. She usually smokes 2 packs a day and has been doing so for 20 years. That gives her a 40-year pack life. Part of our smoking cessation protocol is to identify all smokers and help them quit. We try to counsel Mrs. Tubbs on quitting smoking every time she comes in, but she doesn't seem interested. Since I am the tobacco cessation counselor, I will teach her the 5 R's of motivational intervention today.
I've heard about the 5 A's, but not the 5 R's.
We use clinical practice guidelines from Treating Tobacco Use Independence 2008 update. It recommends using the 5 R's of motivation for patients who are unwilling to quit smoking. The first R stands for relevance. This is where you encourage the patient to indicate why quitting is personally relevant to them. You need to be as specific as possible. You want to tell the patient motivational information that will have the greatest impact. For example, disease status, risks, family, or social situation. The second R stands for risks. Here, you would ask the patient to tell you the negative consequences of continuing to smoke. Risks are things like heart attacks, strokes, or harm during pregnancy. It is important that you tell your patients that using smokeless tobacco or cigars do not decrease these risks. The third R stands for rewards. Here you would discuss the benefits of quitting smoking. Benefits are things like saving money, feeling better, and improved appearance. The third R stands for rewards. Here you would discuss the benefits of quitting smoking. Benefits are things like saving money, feeling better, and improved appearance. Highlight the ones that are most relevant to the patient. The fourth R stands for roadblocks. Here you would ask the patient to identify barriers to their quitting. Barriers are things like depression or lack of support. The fifth and last R stands for repetition. That means that you review the 5 R's every time the patient visits. You want to make sure to encourage your patient that most people have to quit multiple times before they are successful. If a patient desires to quit and would like to try nicotine replacement therapy or NRT, I can recommend several products. There's things like nicotine gum, lozenges, nasal spray, patches, tablets, or inhalers. If a pharmacological agent is preferred, bupropion, SR, varenicline, or nortriptyline can be offered.
Wow, Emily. I never realized that you RRTs did this quitting smoking thing. I cannot wait to watch you and see what you say to Mrs. Tuggs. Can I ask you one more question?
Go for it. I love to teach and share my knowledge.